Everyone, can I have your attention? Can we have a brief? I just need to know what's going on so I can get back to my clinic.
Sure, hold on for a second while I deal with this patient. Okay, he's back in his cage.
The situation that we're having is we're overloaded with contagious patients that need to be examined and treated. The background here is that there's 36 cats and kittens that were surrendered from a hoarding situation early this morning, and some of them have been examined already, and there's evidence of ringworm and upper respiratory disease. Many of them still need to be examined, and we still haven't started treatments yet to the ones that were.
Well, that's not great.
It's not, but my assessment is that we can work together and get the rest of these cats examined and start treatment on them. We could resolve this if we just split up the work and between the three of us and get it done like that.
I agree.
If you need any help, I could assist you. I'll be taking care of some other cats that came into the clinic, so I'll be free then if you need any help.
I appreciate that.
Okay. Now, these are contagious diseases, so we have to work quickly. I want to examine at least 10 to 20 of these cats quickly. Treatment needs to be started immediately on these patients that haven't already been seen. Does the shelter carry any itraconazole to treat orally for the ringworm?
Okay, I'll assist with you with the exams, but we don't carry itraconazole due to the cost. What would you recommend for treatment of the already examined cats?
Let's do lime sulfur dip for the ringworm, and then let's start azithromycin for the upper respiratory infections.
Alright, I can get started on the lime sulfur dips. I'll be in the other room, but don't hesitate to call out if you need me, and I'll also call up to you if I need you.
Okay, perfect. Anne, come on, I need to get to the next cat. Let's go. I need to get back to my clinic.
I'm going as fast as I can. I'm sorry.
Oh.
I need some help. One of these cats I was doing the dips on is in respiratory distress.
Just put on oxygen.
Oh, okay.
Next cat, please.
You know what, doctor? This isn't working. Can we have a huddle to reapproach?
No, I have to get back.
You know what? Stop the line. I'm sorry. I just feel concerned and uncomfortable right now because now this is just a safety issue. A patient right now is in respiratory distress, and there's still a lot of patients that need to be seen. We really need to address this, doctor.
Fine. Sue, can we have a huddle?
Sure, what's going on?
Anne isn't happy with how things are going here.
I'm just concerned that our setup isn't very organized, and now we have a cat under respiratory distress that needs to be addressed too. We're going to risk either missing something on these treatments or exams, or just risk the clinic overall without more help. I think we need another person to help us out so that we could be more effective.
You know, I think Matt could help out. He just started here, but he's learning really quickly. He's been catching on to all of our protocols. I think he'd be a big help. You know, in the end, patient safety is our #1 priority, and if we have one more person to help, I think it would be good for patient safety.
Okay. Matt, can you come over here?
Sure.
Alright, I'm gonna hand off the treatments to Matt. You guys can continue your exam so we can continue with the task at hand. But I think we're good. I'm gonna speak to Matt now, okay?
Okay.
Alright, Matt. So I have a patient in respiratory distress here, so I need to keep a close eye on her. I'm gonna hand off the treatments to you that we're doing on the hoarder cats. So I was doing lime sulfur dips on them before this cat went into respiratory distress. I need you to continue with that. You already know their situation. They might be contagious. They might have ringworm. We're treating them preemptively. Some of them also might have upper respiratory infections, which are also contagious. So follow all contagious protocol, wear your PPE. Also, be careful when handling with them because you can see they're in a shelter situation, very stressed. Make sure to make sure that they're not any more stressed and going through any respiratory distress like this cat went through, okay?
Okay. So what signs will I be seeing in the respiratory distress?
That's a good question. So watch for any open mouth breathing, any increased effort where you see their chest is, putting in more effort to breathe, anything like that, or any wheezing, anything like that, stop the treatments and let us know, okay?
Okay.
Can you do a check back and just repeat back to me everything I just told you?
Sure. I'm gonna do Lyme dips for these cats that were in a hoarder situation. They could have potentially fungal and other infectious diseases too, including zoonotic. So I have to be very careful, including their stress level as well. So I'll be careful not to stress them out too much to cause respiratory syndrome. Thank you for that exchange.
Great. Sounds like you got everything that I told you. Do you have any other questions?
No, I think I got it. Thank you.
Okay, perfect. Don't be afraid to come and ask us questions. We're all here to help you. I know you just started and it's been a lot, but you've been great so far. So keep up the good work and just let us know if you need anything, okay?
Thank you.
You're welcome.
1 hour later.
Doctor, can we hold a debrief before you go?
I guess we just have to make it quick. I need to go.
Okay.
Guys, Sue, Matt, can you come over?
So how do you guys think the day went?
So I'm recently new in this practice, and I wasn't really involved in all the conversations throughout the day, but I overheard some of the arguments, like you suggested to Dr. L about stopping and doing a huddle, but she almost ignored it until you were assertive and you stopped it and you did the true challenge rule. And Dr. L, I think you were a bit unprofessional in this situation. I think you were putting more stress on employees that could have caused even more problems with our patients as well due to that.
Okay, so
This is an issue because it puts us under pressure. It can lead us to make medical errors unnecessarily and even affect the face of our practice to the public domain as well.
I guess that's true. I didn't really think of it that way. I never want to put my patients at risk. So I'll try and do better next time. I'll try and be more respectful, and I'll keep in mind that I'm here for the patient.
Thank you.
We appreciate you saying that. You know, I wanted also to give some positive feedback to Matt. And I think he did a really great job today with the lime sulfur dips, stepping in to help us.
Thank you. Is there anything I could have done better though in those lime sulfur dips?
Yeah, I think I noticed some of the cats were pretty wet still after you did the treatments. And you know, when patients are cold, that's not great for their well-being in general. So if you could just dry them off a little bit more, towel drying, even using the hair dryer in the lowest setting, or doing that and then putting them on the bear hugger, I think that would be good for them.
Got it. I appreciate the feedback.
One more thing I want to add is about when Sue came into the room with the cat in respiratory distress. It was right for you to call out so we were aware of the situation, but in the future I would do so calmer. So we don't spook our patients, especially these cats that are already in a stressful situation for being in the shelter alone.
Okay, yeah, I can see your point. I was pretty panicked and I could see someone getting spooked and that not being a good situation, so I'll definitely tone it down a little in the future and be more calm.
And I also noticed you weren't wearing gloves when you were checking the patients.
I'm so sorry about that. I know it's my responsibility to wear the proper PPE in these situations to make sure there's no contamination to our patients. It will not happen again. I promise.
I think in general, all of this, I rolled up my sleeves, you know, that it's not great, controlling the ringworm situation, so I think we can all work on it.
Yes, I agree.
Great. Let's hope we all don't have